Hello there, everyone, and good evening. We'll be starting in 2 minutes. Feel free to put a message in the chat and say hello. Thank you. Good evening, and welcome to the National Education Union's All Members Call. There's thousands of people on this call and watching on social media already. So just to point out, if you do ask a question, it will be public on social media if it gets asked. So just to bear that in mind when asking a question. We have a number of accessibility features on this call. At the bottom of the screen, you'll see a button that says closed caption. If you press that button, you'll be able to turn on subtitles. You'll also be able to download a transcript of this call. We also have Sam Riddle and Nikki Evans providing BSL interpretation services this evening for those who need it. We also have a team of staff working behind the scenes. So if you need any help, just post a message in the chat and we'll be able to help you. Someone has also posted the NEU behavioural statement. So without any further ado, I will hand over to Robin Bevan, the NEU National President, and good evening. Thank you.
Thank you very much, Mike, and thank you to everyone who is working behind the scenes to make sure that tonight's call for thousands of NEU members runs smoothly. Thank you very much for joining us. It's great to see the various comments coming through in the chat. You will realize that the chat is going to move very, very quickly tonight. So we won't be from the panel monitoring the chat, but you can still have a little look. And a reminder that if you are posting messages in the chat, please make sure that you post them so that everybody can see them. If you send your message, just as Laura Denise has done from Lincoln, so that it says all panelists, then it's only that little group of us on screen who get to see your message. So change the drop down so that it says all panelists and attendees. That way, I'm going to read through a few of you: Sabahat from Buckinghamshire, Julian from Exeter, Zoe from Hitchins, Sarah from Halifax, Tom from East Sussex, and Jonah from my beloved Southend-on-Sea. Everybody will be able to see your messages. So please do just make that little change. And fabulous, Jonah's just done it. I spotted that going through. Second thing to say is, as Mike has indicated, tonight's meeting is being recorded in the Zoom facility. So please make sure that everything that you post in the chat and anything that you put forward as a question is appropriate for a public audience. So obviously no private information about you as an individual, or indeed anything that might be construed as being disrespectful to others on the call. You've got the opportunity to place questions in the Q&A function. That's where we're going to pick them up from later on. The team behind the scenes is coordinating and collating those. You're not going to be able to place questions in the chat function. We won't be able to see them there. Please put them in the Q&A function and we will do our very best to answer them. Tonight, we should be talking together about pupils, about learning, and about well-being. But we won't be. Tonight, we will be, I expect, talking about LFTs and face masks and the risks to vulnerable staff, about rotas and phasing. And the reason that we're going to be doing that tonight is because Boris Johnson and the government have gambled on bringing all pupils back into school very early in the COVID recovery. Our view, too early. And so we're left with a whole set of issues that tonight Mary and Kevin will be advising you and guiding you on. Listen carefully to their comments and advice, extract from it what you need for your own situation. The second thing that I want to say is that those of you on the call tonight will have had very different experiences of the impact of COVID in your workplaces. Some of you will be feeling genuinely scared and worried. Others of you will be more buoyant and feeling that now is the right time to get back into school and eager to be back with your classes. Some of you will have seen your schools torn apart by COVID before Christmas. Others of you will have been barely affected at that time. So please remember once again that our advice and guidance tonight has to be context specific. We can't give one message for every workplace, but what we can do is give you the principles that apply wherever you work. And finally, from me, before I hand over to our joint General Secretaries, Mary Bousted and Kevin Courtney, let me just remind you that across the last 12 months, one thing has been absolutely clear. Time and time again, the National Education Union has pitched its advice based on evidence and science absolutely correctly. We were right at every point through each of the lockdowns in the advice and guidance that we gave. And we have no intention of changing that. We're listening, we're advising, and we're guiding based on the very best evidence. Please listen carefully. Thank you for joining us tonight. I can see from the numbers here that we're into several thousands of you on the call, NEU members together, ready to hear the advice of your joint General Secretaries. Mary and Kevin, thank you.
Thank you, Robin. And thank you everyone on the call for joining us tonight. Mary and I want to use our time with you this evening to tell you about the NEU's actions to make school return, commencing, as we know, from the 8th of March, as safe and as secure as possible, both for our communities and for staff. We know that amongst NEU members, there's a wide range of opinions about school return. We know that because last Monday, when Boris Johnson made the announcement, we surveyed our members. Lots of you on this call have taken part in that survey. Thank you very much for doing that. We asked what your feelings were about school return, what safety measures you thought were in place in your schools, what measures you thought should be in place, what you thought about the Big Bang return. 44,000 of you took part in that survey. That is a huge response in one evening. Thank you for taking part. Our members' opinions and views are everything to us. We can decide nothing about how to shape the NEU's policy, campaigns and actions without knowing what our members' views are. So who took part in the survey? What did you tell us? 3/4 of the respondents were classroom teachers. The rest were school leaders and support staff members of our union. Those are the right sorts of proportions. We asked about a wide range of issues. There was strong agreement, and you will not be surprised by this, that social distancing between pupils is not possible in a meaningful way in our schools. A clear majority of respondents in both primary and secondary schools supported mask wearing for pupils. And it was a bit surprising to us, a clear majority said that their classrooms were well ventilated. There was a significant minority who said their classes were not well ventilated. We asked about the feelings about the government's plans for reopening. And I'm just going to close down Teams because it's making lots of noises. We asked about what you thought about government's plans for reopening, and 9% of you said you strongly supported the government's plan for opening on the 8th of March. 22% of our members said they tended support, 9% said neither support nor oppose. So 40% who didn't click one of the oppose options that we put forward. 30% clicked tend to oppose, 29% clicked strongly oppose. What's interesting, if you break those figures down by sector, you get divergent results. So amongst our members in primary schools, there was more or less an even split between people supporting and opposing the government, with about 10% with no opinion either way. Whereas in secondary schools, 71% of members opposed the government's reopening plans, either strongly or less strongly, but 71% opposed. That maybe reflects the fact that there is some evidence of greater potential for transmission amongst older pupils than amongst younger pupils, or perhaps the greater difficulty in engaging primary children in online lessons.
Good evening, everyone. So what is really clear, as Kevin has said, is that whilst members are really concerned about safety, they are also really concerned about their pupils, particularly those who have not been able to take part well in remote and blended learning. For example, the over 1 million children and young people who don't have access to the internet or don't have laptops to work from home. They're concerned about the children who don't have a quiet place to work because they live in overcrowded houses. Those children whose parents or carers can't help them with their learning. And our members know that for some children and young people, lockdown has made them less safe, and that some will have suffered real trauma. And they are concerned about these issues because they are teachers and support staff and leaders, and their care for the children and young people in their care does not stop when there's a pandemic. That's why the NEU, in conjunction with the Mirror newspaper, launched its campaign to help a child to learn and donated £1 million so that children without pens and paper, without exercise books, were given these essentials from the union. It is remarkable to think that in some remote lessons, when the teacher said, now get a pen and paper, there are some homes when there's no paper that children can use. And now we only have that money because of COVID savings, not paying travel to reps courses and to conferences. But it should never be said that the NEU does not care about children and young people. We want them in school and college. We want them back, but we want them back safely. And we do not want to risk a third wave of the virus, which would not make for a safe or sustainable school return. Throughout the COVID pandemic, the NEU has based its campaigning position on the science, and we've had two main concerns throughout: community safety, and we want to stop or to suppress the transmission of COVID from pupils to families. That has been our key concern, community transmission. We've also had another key concern, and that is about staff safety, protecting the health of our members and education professionals generally. So it is really important to note now that scientists are not united in their view about the government announcement, and there are different opinions based on the different readings of the science. And as Kevin said, it's also important to know that our members feel differently about school and college return. When asked about how they personally felt about the reopening of schools, most members were concerned. Some were nervous, and a smaller percentage, 13%, were scared. But 6% of members were happy, 8.5% were relieved, 7% were resigned, and 3% were indifferent. So you, like the scientists, have mixed feelings and mixed views, and that's entirely to be expected.
And like Mary says, and quite unlike January, scientists now have much more mixed views. There's a group of scientists that we follow closely, such as Deepti Gurdasani, who is managing to get herself a lot of media attention, and we're really pleased with that, who is arguing that the government strategy is wrong, that school return should not be happening now, should only be happening when infection levels are much lower, when hospitalization rates are lower, when much more stringent mitigations are in place, ventilation units in classrooms, mask wearing by all pupils. She strongly speaks for phasing of return. We're worried that she and other scientists like her are right, and that after Easter, we will see cases rising again, and we may end up excluding many students again, or even being forced back into lockdown. There are other scientists who read the things slightly differently. Amongst them, prominently, Neil Ferguson, who was the brains behind the modelling of 500,000 deaths that finally got Boris Johnson into lockdown last March. On the PM programme on Radio 4 last Tuesday, he said it was right to open schools everywhere, that opening schools would increase the R, probably above 1, but that the spread of the vaccine would reduce it down again. And that is what Chris Whitty said at the Prime Minister's briefing on Monday evening. There had been speculation that he wouldn't appear alongside the Prime Minister because of reported splits, but he did appear and backed the Prime Minister to the hilt. Now, we still think the government is wrong. We still think they should have been more cautious and behaved like the government in Northern Ireland, in Scotland, and in Wales. But they are talking about the vaccine dragging the R down. So they accept that at each stage of relaxation, they'll raise the R rate, but they hope that the spread of the vaccination will still get the total number of cases, the total number of hospitalizations and deaths falling. That situation is complex. Now, none of that about complexity is not to say that the situation is not very serious, and all of those scientists would agree that it's still very serious. There are still high levels of infection in the community. Cases are falling, and they are falling amongst secondary students and amongst primary students in most of the country, not everywhere, but in most of the country they're falling. But levels in the community are still uncomfortably high. Hospitalization rates very high, but both hospitalizations and deaths now coming down rapidly. These are still high, and but starting to reduce, and that's what we expect to happen across the next period. And what is the game changer on all of that is the one government success story throughout the whole of this pandemic, actually an NHS success story, the rollout of the vaccination. The government now tells us that they will have delivered a first dose of COVID-19, of the vaccine, to all over 50s by the middle of April. By April the 15th, all over 50s should have had their first dose of the vaccine. Letters to 60 and 63-year-olds sent by invitation today. And there was the good news last Monday that one dose of the vaccine gives high protection against severe disease and admission to hospital, and significant protection even against mild disease with no symptoms. So all of that changes the scenario in which we work. It provides the framework for the demands that we now make and for what we can win in the workplace to keep our communities and staff as safe as we possibly can.
So as Kevin has said, our position has always been based on the science. And what the government's own scientific advisory committee, SAGE, told Boris Johnson on the 11th of February from their minutes, what they told him was a phased return was recommended, with some primary year groups going back from the 8th of March. SAGE recommended this phased return because the scientists on SAGE who advised the government thought that this was the best way to keep the reproduction, the R rate, down. Any school opening would, SAGE said in its minutes of the 11th of February, tend to raise the R rate. The Chief Medical Officer for England, Chris Whitty, agrees. So SAGE said it was important to assess the effects of a cautious, phased opening of schools, starting with primary, so that if schools' infection rates rose too quickly, actions could be taken to suppress transmission. And all the education unions, including the support staff unions, wrote a joint statement on the Friday before the announcement last Monday, calling for a phased school and college return. The government chose not to take SAGE's advice or our advice and to go ahead with a full school and college reopening with all year groups from the 8th of March. Now, we hope that return will go well, because we want schools to be open and we want children to be in them and learning, but we want a safe and sustainable school opening. So we will also hold the government to account if the consequence of too rapid an opening, if 8th March proves to be too rapid, if that results in rising infections in schools and from schools into the community. And if the safety measures in schools and colleges are not up to the vitally important job of suppressing transmission, and in particular, suppressing transmission of the much more infectious new variants of COVID. So what has the NEU been doing, and what will the NEU be doing during and after the return to school? This is what we will do. We will continue to make the case that a staggered return to schools would have been safer and better. So we will continue to campaign for that and for additional mitigations, including referencing to the SAGE papers that support phasing or a staggered return. We will focus with renewed effort on the NEU school COVID map, which shows local case rates around schools and shows a 7-day average across the last week and is updated daily. So that shows the wide variation in infection rates across the country. And we will link it to statements for phasing, for rotas, for circuit breaks, and for greater mitigations, greater focus on health and safety if cases start to rise. And the NEU will continue to advocate to accelerate the vaccination schedule for frontline key workers after the completion of vaccines for 50-year-olds. This is a key issue which is being raised on NEU Facebook pages, on Twitter. It's clear that members want access to priority vaccination. Now, we have always been clear, and I think it's important to be clear, that vaccination will not suppress the transmission from pupil to pupil and out into the community. And there have been big debates amongst unions about the dangers of pitting key workers against other key workers in a vaccination race. But we are clear that schools and colleges are crowded places, largely filled by unvaccinated children and young people, 15% of the UK population. So there is a strong case for vaccination, priority vaccination for education professionals. There has been an idea raised of a vaccine premium for school staff based on adding some years to the calendar age of key workers that may be worth exploring. But we will strongly campaign for vaccination for educational professionals who we now know through ONS data have the 4th highest rate of COVID infection. And actually these rates are higher if you take out university teachers, and the highest of all for support staff.
And so Mary's talked about what we're doing at that political level. Now we want to talk about at the workplace level. And if you are in a school or college with a rep, we want to ask reps to hold virtual meetings of members to engage now about what makes things safer and to engage with school leaders. If you're in a school or college without a rep, we'd urge you to volunteer and to become one. And we've said we're still in favour of phasing, and actually, if it's possible to persuade your head teacher to stagger re-entry, we think that is the better approach. Now that is quite widely accepted in secondary schools, I mean in large part because of the difficulty of running the LFT programme that they have to do, but there are good reasons other than the testing programme. The more phasing there is, the longer there is for cases to fall, the less time there is before Easter for cases to build up. And we do think there are arguments even in primary schools. It might be very sensible in a primary school to get the infant classes back first, to allow them to run off some of the energy, to have space in the playground, to work out the routines by which parents will bring them into school and drop them off before starting with the junior school. So if you can persuade your head teacher of that sort of approach, that would be a good thing to do. In secondary schools, that argument is even stronger because of the testing, and I think because of making sure that the mask wearing is properly bedded in with each year group as they come in. In addition to looking for those sorts of staggered plans, we're asking members reps to meet with members to go through new joint union materials, which look at red lines drawn from union and government guidance, and to look at those with your head teacher and to negotiate for the safest possible return to school. These cover things like the testing regime, mask wearing. We say it is right for primary staff to wear masks in classrooms. Ventilation, the need to have as much ventilation as possible. Every bit of ventilation helps to reduce transmission. That vitally to say that there should not be in-person staff meetings. Transmission between staff is a fundamental thing that happens. and we should minimize it in every way we can. In-person lesson observations should not be happening when that means that staff are closer together. And also that we want you to talk with your rep, or to become a rep, to talk about the maximum protection of the most vulnerable in the run-up to their vaccination. Now, we know from all of the science that the fundamental vulnerability to this virus varies with age. That every decade you go up, you double the risk. So that there is much more risk for older staff than for younger staff. And those risks dwarf everything else. Other factors add in, ethnicity, and men are more of a risk than women, etc., and the comorbidities. But age is the fundamental question. And we now understand that all over 50s and all the people aged 16 to 64 with a range of medical conditions identified by the JCVI, that they should all be vaccinated by mid-April. Many of them before mid-April, obviously, if that's the last date. Now, JCVI, that's the Joint Council on Vaccinations, they tell us that those people cover 99% of all those who died in the pandemic. So we really think that this is important, that we offer as much protection to those people as we can until their vaccines are in place by mid-April, and also that we encourage all of our members in these categories to take that offer of a jab when it comes up. And we think that in the vast majority of cases, head teachers will engage and help put these things in place to make sure that tests, masks, ventilation, no in-person staff meetings, as well as the one-way systems, as much of a limit on bubbles as we can, etc., are in place. We want head teachers to think about how they protect those older staff. In some cases that might be, and if it can be, we'd like it to be, continuing to work from home. In others, it may be being in the best ventilated classroom with the best quality medical mask, but protecting those staff until their vaccine kicks in, until they've had their vaccination, that kicks in, is something that we want to talk to head teachers about. In a number of schools, quite a small number actually, we've balloted for, and in some cases are taking industrial action where the ballot itself didn't work. And in some of those, we've advised members to use Section 44. But in January, we have to say our use of Section 44 led to a quicker change of policy from the government, and that was enormously to our members' credit. But we can't say that Section 44 is always the right thing in all circumstances. I imagine there'll be some questions about that, and we'll deal with that as we come up to them. But we do want to say on this, it's not sensible to use Section 44 without advice from your union's regional office or Wales office. You really should be getting advice if you're contemplating the use of Section 44. And that's because the requirements that Section 44 has about having an imminent serious danger, we think you should talk to the union about that before you use that Section 44 provision. We also want our branches, and we think this is going to be really important in the run-up to Easter and in the weeks after Easter, to engage with local public health officials and local authorities to examine local trends in the data. The cases do vary across the country, and if cases are going up, then there is a really strong case for looking at rotas in school operation. SAGE told the government in September that rota operation can have the same effect on suppressing the growth of the virus as closing the whole of hospitality. So we think there's the chance of a renewed case for rotas if, despite everything else the government does, despite the vaccine rollout, etc., if cases are still going up, we think there's a renewed case for rotas, and we want to make that strongly. Last week, we had a Zoom call with parliamentarians, and we had 45 MPs or their researchers on the call. That's a very good number for these sorts of things. We had MPs from all of the main political parties there. We were engaging with Conservative and Lib Dem MPs, as well as Labour MPs, asking us questions, and we made a strong case for them considering the use of rotas if cases increase, as well as making the case that we've made for a phased return. We've written to all heads and employers, asking them to ensure that they continue to employ supply staff. We've published an updated return to work safety checklist specifically for supply members, and we've been pressing government for the continue of furlough with a right to be furloughed where work isn't available.
I've missed.
Just for a moment, we've lost Mary's video link, and I know that she was about to offer us some more commentary before we come to the questions. Just while we're waiting for Mary to rejoin us, and we can now see Mary. And are you ready to pick up from there, Mary? You are.
Yes.
Thank you very much indeed. Fabulous. No
Sorry
problem.
about that. So I'm just looking at the chat line. I was going to say something else, but I'm just going to look at, I've just looked at the chat line and people are saying ballot. And so whilst people are saying that, they're obviously getting frustrated. I thought I would just answer that, that point. The indication we have from the membership is that they would not support a national ballot. We would not get the ballot thresholds that we need to take a national ballot. And a national ballot takes a long time to organise, certainly much longer than the return on March the 8th. The thresholds are extremely high, and there is no indication that we would meet those thresholds. So the National Executive debated that issue and came to the conclusion that a ballot is not the right way to go ahead. What is the right way to go ahead is to ensure school by school that the return is as safe as possible. Given that infection rates are falling, given that hospitalisation rates are falling, and given that the vaccine rollout is taking place. That is what the executive agreed. You know, you can't just simply say ballot and then a ballot could just take place immediately. There is trade union industrial legislation which you have to abide by. But actually, it's not just that we have to abide by the trade union legislation. We do not think, and the executive, you've got 78 member executive, and they agreed that that would not be the right move at the current time, not only because we wouldn't meet the thresholds and that would weaken the union, but because the situation has changed from 3rd of January. It has changed. The infection rates are down, as Kevin and I have said. The hospitalisation rates are down. The infection rates are down throughout society. Now then, what we have to do is we have to look at the situation as it develops. We are going to meet with the executive after Easter when we've had 3 weeks back at school, and we will look again at the situation that is taking place in schools. We're going to keep a very, very close eye on the ONS data of infection rates in school. And we're going to also keep a very close eye. We had a meeting last week with the National Statistics Authority, keeping a very close eye on all the data, transmission within schools and transmission from schools out into the community. So it's an easy thing to say, ballot, but that is not going to stop the school return on the 8th of March, and nor is it something that we think would be achievable, and nor do we think the executive think it is the appropriate action under these new circumstances. So Robin, I just wanted to answer that question before I hand it over to you for the wider questions, because I wanted to just answer that question immediately.
Thank you very much, Mary. And as I said at the beginning of the call, we're going to have people with a variety of perspectives, a variety of views, and our job as a union is to reflect the views of the membership nationally and to give advice and guidance that allows each member of our union, together with those they work with in their workplaces and across their branches and districts, to respond appropriately to the challenges that they face. And so we've got a series of questions that are on other themes apart from industrial action. And the first set of questions, which actually probably reflect the bigger concerns amongst the membership, start off with a set of questions around vaccines. Kevin, I'm going to be coming to you with these questions, if I may. So I'm going to pick up first a question from Kate, who says, why aren't school staff being vaccinated as a priority, and why isn't the NEU making this a high-profile demand? Well, Kevin, you might tell us in a moment, we are making it a high-profile demand, but that's the question from Kate. From Sarah, why did we oppose teachers having the vaccine during half term? So that goes back to a proposal that I have to say, Sarah, was not quite as clear cut as you're making it, but Kevin will respond to that. From Angela, thank you, Angela. I'm very concerned that staff I work with are not vaccinated yet. while special school staff have been. I have to say, Angela, not all special school staff have been, but some have been. You're quite right. Our school is a school with a resource base where we have clinically vulnerable pupils. These pupils require intimate care. So clearly there is an issue for those staff who are working closely in that context. And a question from Simon. Thank you very much, Simon. What should a mid-50s male do? Go back to school without a vaccination, or will the union support waiting until the vaccination has been received and taken effect? Kevin, it's a range of questions. They do absolutely address concerns that we know are widespread amongst the membership. So perhaps you could pick up some of those themes at this point. Thank you.
Thank you very much, Robin. And like you say, that demand for priority vaccination is strongly held by union members, and we have indeed been advocating for it. We joined up with all the unions in making a statement for it. I don't know, we didn't oppose vaccination of teachers over the half-term holiday. Labour made it as a suggestion. The government never went anywhere near it, but we didn't oppose it. The question of why teachers and support staff aren't being vaccinated as a priority is something that we addressed directly with JCVI, that's the Joint Council on Vaccination, in a meeting that we held with them last Friday, when they made the announcement that after going to the 50-year-olds, they were then going to carry on going down through the age groups. I was happy to be in that meeting along with JCVI, and a doctor called Adam Fine from JCVI, who's a paediatrician in Bristol, was there to explain their thinking. So I pressed strongly on asking questions about why they hadn't included education staff, and also specifically a question that had been raised with me about staff members who were asthmatic, who had been labelled as clinically vulnerable, and that then aren't in that rollout of the vaccination. So the answers we got from JCVI, and in saying that these are the answers, this isn't saying that we're happy with these answers, but it's just to tell you the answers that we got, and then how we're thinking of carrying on pushing it forward. So Adam Fine's answer, the answer from JCVI, was the thing I was referring to earlier. He says that the risk of serious COVID doubles with every 10 years. So a 70-year-old is twice the risk of a 60-year-old, at 4 times the risk of a 50-year-old, at 8 times the risk of a 40-year-old, at 16 times the risk of a 30-year-old, and at 32 times the risk of a 20-year-old. And that is the fundamental variation that JCVI saw. They also know that men are at about 50% more risk than women in the same age groups, and there are the variations with ethnicity that we've heard about previously, and then there are the comorbidities. But their attitude was, with it varying so strongly with age and with the vaccination working so quickly, they were worried that moving to an occupational scheme would slow down the rate at which they gave the vaccine out. Now, we had thought that this might be a problem several weeks ago, so we raised with the DFE that they needed to be working out where the data was about who the teachers were and the support staff were, so they could provide that. But JCVI believe that they will save more lives by going straightforwardly down the age groups, and that's their argument for it. We are continuing to press the case. We have to accept that this variation with age does matter, that 30-year-olds, 20-year-olds are very unlikely to have a serious run-in with COVID. But we do think it matters that teachers and support staff, we still believe, although there's some science came out today that disagrees with this, but we think on other bits of science that we've seen that teachers and support staff are more likely to contract COVID. And therefore we think there is a sense in which that if you're a 45-year-old, and we're starting to argue for this case, that they add 5 or 10 years onto a teacher or member of support staff calendar age and vaccinate them alongside people of that age. So that's the way we think we're best off pressing the case. We do know that in many places, there are the 10% of vaccines that are left over at the end of every day because people don't turn up. And in many places, people are contacting key workers And we know that teachers, police officers have been vaccinated with that 10%. So that's what JCVI said. On the question of asthmatics, they told us that having looked at the data, that they thought the risk of serious COVID varied with people who have oral steroids or who've been admitted to hospital, and the other cases of asthma they think don't have that significant risk. That I'm not saying that I agree with them. That's what they told us, and they thought that going with age was the right thing. So we pressed the case in that conversation with those scientists, and we pressed the case with government that, as well as the scientists asking the question about who is most at risk of serious COVID, there is another question. There's a question of what would most disrupt the running of a key service like education. And if you vaccinate teachers and support staff, then you reduce the risk of disruption to the running of education. So that's how we're pursuing the argument on it. A specific question that was asked about somebody in their mid-50s who, I do think that somebody who is 60 or in their mid-50s, they're coming up to their vaccination, they are much more at risk than other staff at the school. And if there is a way of persuading the head teacher that they can work from home or that they can be looked after in some other way, I think that is worth looking at. And I think that's worth union groups meeting together and thinking about, how do we protect those staff who are most at risk in this situation? And that is part of the guidance we've given to our reps about how to have the meetings with members and how to talk to head teachers about the greatest degree of protection that we can get.
Thank you very much, Kevin. And for those of you who have joined the call partway through, just to let you know that we are answering questions in themes that have been posed in the highest numbers by those who are on the call. We've got nearly 300 separate questions posed, so we're catching the themes and directions. We're not going to be able to respond, obviously, to every single one of those questions, but they will be used to help shape advice going forward. Thank you to Kevin for picking up on some of those questions that related to vaccinations. We're now going to turn to a set of questions on the second most popular theme, and that's around the wearing of masks. And I'm going to come to Mary for the face covering questions. First from Stephen, who's a primary school year 6 teacher. Thank you very much, Stephen, for your question. Our trust have stated that staff can't wear masks in classrooms as DfE guidance does not allow it. Is this true? A straightforward question about the DfE guidance and adhering to it. Victoria asks a question. I work in a middle school which has both Key Stage 2 and Key Stage 3 pupils. Victoria, I'm going to say now that it's one of the long-running difficulties with the department is they seem to forget that schools like yours exist. So you never get clear guidance, but it says, what is our position with face masks in a mixed setting? The pupils are in year group bubbles, but teachers move between all year groups throughout the day. And Colleen, are there provisions for pupils that refuse to wear a mask or do an LFT? What steps should staff take in these instances? So that's about the recommendation as opposed to the requirement, as opposed to it being mandatory. So Mary, if you could pick up some of those themes and I'll just have a look at what next our members are asking us. Thank you, Mary.
Thanks, Robin. So, Stephen, your trust telling you that staff can't wear masks in classrooms is wrong. The latest DfE guidance is that masks should be worn by teachers, adults, and all children, both around the school and in lessons throughout the day in secondary schools. That guidance will be reviewed at Easter, but in secondary schools, masks should be worn in classrooms and throughout the school by pupils and by staff, by all staff. For primary schools, children aren't required to wear masks, but the staff, teachers and support staff are allowed to wear masks in primary schools. The DfE guidance changed on that issue last week. So the DfE are now saying the science does support the wearing of masks in classrooms by primary teachers. It's not mandated. It says it should be up to this should be something that is the head teacher allows. But if your school group sees that is important, then it's important you have a meeting and you make that clear to your trust that in fact they have got that advice wrong, and you are allowed to wear masks if you are a teacher in a primary school classroom. The Victoria, the middle school with Key Stage 2 and Key Stage 3 pupils, well, the Key Stage 3 pupils should be wearing masks in classrooms. The Key Stage 2 pupils won't. But as a teacher or as a member of support staff, you can wear a mask, both in the Key Stage 2 and the Key Stage 3 setting. So the DfE guidance, as I said, changed last week. And Colleen, are there provisions to pupils that refuse to wear a mask or do a lateral flow test? There aren't provisions for that. And indeed, that is quite difficult. But there is an expectation in secondary that pupils will wear masks. And if a pupil isn't wearing a mask without a good reason, without a medical reason that they have an exemption for that, then there should be procedures in schools that would, hopefully explain to that pupil and their parents why mask wearing is important, would explain the fact that transmission did happen in secondary schools from pupil to pupil, and that by December, secondary school pupils were the most infected age group. And the science coming from the government, because this is DfE guidance, is that the mask wearing is a help. It is a help in suppressing transmission. I think the issue with lateral flow tests is really more problematic, because what the government is saying is that in secondary, the first 3 tests will be done in school, and then pupils will be doing 2 tests a week for themselves. So the government wants the first 3 to be done so pupils learn how to do lateral flow tests properly and then carry on doing them at home. And in primary schools, parents will be given lateral flow test kits to do them at home. Now, when we ask the membership, they are very, very supportive of the lateral flow tests. And so that's something that gives members more confidence. We think they are problematic. We think that we have, there are clear questions being asked by the scientists like Professor John Deeks about whether they are sensitive enough to pick up viral loads, particularly in children and young people who will be asymptomatic. And of course, there is the issue about whether adolescents will actually do the tests, because they're not very pleasant to do. Nevertheless, the government's mandated those that those tests will be done. And again, we think it should be encouraged. If they can work and if they are going to be of any use, then they have to be administered. Our concern, more than anything else, is that too greater confidence isn't placed in lateral flow tests, because if people believe that the lateral flow tests are negative and they're not actually negative, then what will happen is that there will be some relaxation of social distancing rules. There will be less focus on hygiene, less focus on washing your hands, less focus on ventilation. And if they aren't sensitive enough and they do allow pupils or members of staff who are positive to come back into school, and those other mitigations don't take place, particularly the mitigation that if you have been in close contact with someone who proves to have COVID, then you should isolate. If you don't keep those mitigations in place, then the danger is lateral flow tests will not work to actually suppress transmission. They will work to increase transmission. So lateral flow tests, the only use they have is as an additional precaution. They do not take away the need for all the other mitigations, including isolation. If you are in close contact with someone who are a pupil, or from pupil to pupils if they have COVID.
Thank you very much, Mary. It's very helpful. And I know that members on the call tonight will be listening to the advice and seeing how it applies in their own contexts, and also thinking about those issues that they may need to raise through their reps collectively with their members in their school or college. And we've got, and perhaps not surprisingly, we've got a set of questions that are around colleagues working in schools who are in one way or another at greater risk, and they often referred to as vulnerable, but the reality is that there are some groups of staff members who are at greater risk of infection and consequences. So I'm going to take these as a group, Kevin, if you're happy to take them in that way, but they're illustrative, and it may be that as we go through them, it's the themes that emerge that are more important than perhaps the individual details. A question from Nikki. It says, how about those that cannot be vaccinated, such as pregnant women, unable to have a vaccine, unable to social distance, and schools opting if they allow them to work from home or not? I don't think, Nikki, that's quite right in relation to at least the latter part of pregnancy, and Kevin will come in on that for us in just a moment. I've got a question, and the lady or gentleman who's posed it hasn't left their full name. All I know is it's a Mr. or Mrs. or Ms. Patel. I'm a teacher who's from a BAME ethnicity. My ethnicity has suffered more cases and deaths from COVID-19. Is there particular advice for BAME staff? I'm feeling very unsafe. Patricia, I don't know what to do next week. I'm the only class teacher in my school who's over the age of 50. Will the union support me if I ask to work from home or ask for a smaller class? And a question from Alison, which just looking at the details of this is essentially around staff members who have family members who are clinically extremely vulnerable. So Alison teaches in a secondary school. Her partner is CEV and currently on chemo treatment for terminal cancer. The first thing I must say, Alison, is our best wishes to you and your husband in these circumstances. Alison is very nervous about being forced back to face-to-face teaching and bringing home the virus with the consequences it might have. I feel I should work from home until he has had 2 vaccines, given the best chance of being safe when I get back to school. What's the NEU advice for those who are living with shielding individuals? So there's a blend of questions there, Kevin, and look forward to your advice on those. Thank you.
Thank you very much, Robin. And I do feel for everybody who's asking those questions and the risks that people are talking about. They're felt very deeply and they are real. Now, I think we have to try not to minimize, we have to try not to exaggerate as well. And nobody on the call is exaggerating. But cases before December were really high. And in January, they were really high. They have fallen back. And now cases amongst primary and secondary children are at the sorts of levels they were in September and October. And that isn't good, but it's not where they were in December. Now, that means that all of us have got to do everything we can to try and keep them there and to stop cases rising again. But when we open schools, when schools open in a week's time, that's the sort of place they'll be at the levels we were at in September and October, not at the levels they were in December. But that isn't to minimize. There's still risks and we have to do everything we can to minimize those risks. And the first of those questions, the fact that some people can't vaccinate, that matters not just for an answer about members, but it also matters for an answer about our society, because there are ranges of people who can't vaccinate because of allergies as well as because of pregnancy. And so it matters that we all try and keep cases down as much as we can. Our advice, if you're pregnant and you come up to vaccination, is to talk to your GP, because I'm not sure that it's a complete ban on vaccination of pregnant people, of pregnant women, but we certainly think 3rd trimester pregnant women should be working from home. Now, the government doesn't quite agree with that, although they do raise concerns, but we do agree with that. And we have succeeded in getting that in lots and lots of institutions. So we would like you to, in your school groups, to discuss that, to go to the head teacher and say, how can we protect this person? And then if we've got a 3rd trimester, if we've vaccinated other people and the 3rd trimester woman is there with the enhanced risk of that and not being able to be vaccinated, then that adds to the argument. And the Mr. or Mrs. Patel or Ms. Patel, we recognize that there is absolutely an increased risk, as all the scientists tell us, around BAME, which adds on to the risks of, if you are a man, and adds on to the risk of age. And it's something that your head teacher should be looking at in the case of an individual risk assessment. And you should approach them and say, I've got, talk to your union rep, but go to the head and say, I'm worried that I have these additional concerns. Now, we don't know. I don't know whether you're a man or a woman. I don't know how old you are. But certainly all those things can add together. So you want those to be looked at in the individual risk assessment and find every way you can to protect you, to do that bit of protection. The case of the person who is the only 50-plus-year-old teaching in their school, that should be an easier thing to resolve if you think about the fact that that means that everybody else is not there, that if it might well be possible to persuade your head teacher. I would think that this is something that you should talk to your rep about and talk to other people about and think about what you can do from home and then approach the head with it in those ways. But we know that you should have been vaccinated by the 15th of April, should have then significant antibodies a fortnight or 3 weeks after that. So if there is a way of having further protection during that period, then that is really something to look at. And then the last question, was it Alison? Alison, who has, and Robin expressed that sympathy with you. Your husband is at home with terminal cancer and having chemo treatment. And I think everybody should be wanting to think about what they can do to support people in your position. And certainly I think that's something that is really worth talking to your head teacher about how you can have the maximum degree of protection and talk with your union group at school about how that can be achieved, and then take that to the head teacher. But it seems to us completely sensible and reasonable to think of the maximum ways that you can be protected from taking that home to your husband, and looking at the maximum ways of that protection until your vaccination comes on stream. I don't know when that is. We don't know your age, so we don't know that. But these are things now to take up at that sort of way with your head teacher. Now, Robin, I've spoken with Robin. Robin is a head teacher, you know, as well as the NEU president. And I've spoken with Robin about how he is addressing these issues with members in these categories at his school. And our members will be concerned about these things. The reps will be concerned about them, but many head teachers will share those concerns and want to work with us. And we should share the successes in the reps WhatsApp groups that we've got in most districts, so that we share the victories where older teachers or teachers in that sort of situation are working from home. So we can take them to the head teachers who haven't quite seen that it is a route to go down, a possible way to do it. So share successes, talk to heads, talk to your reps. But yes, we think look for every bit of protection that is possible, especially for the older and those CEV people, until those cases are in place. We can't give precise advice on all of the success of the vaccine. We're told that even one dose conveys really substantial protection, but we're all in the same place as you, looking for the science on that. And we all want to protect our members as much as we possibly can in the political circumstances we're in.
Thank you very much, Kevin. And we're going to take a couple more sets of questions at speed in the time that we've got remaining, and then we'll wrap up towards the end with just some final words of encouragement and advice to guide all of you on your work together with other NEU members in your schools and colleges, galvanizing support where you need it, with guidance also from branch and district to assist with the challenges that we face. So the next set of questions, and they're the inevitable questions that arise when we're dealing with schools. Questions about accountability, about assessment, about inspection, about marking, about appraisal. And I've got a set of 4 coming together here. And Mary, if you're happy to pick these up. Andy asks a question saying, now that Ofsted are once again carrying out inspections, is it acceptable for our workload to increase at the same time as pupil numbers do? Is there anything we can say to our supportive head in a school that requires improvement school to preserve our well-being? It's good to hear about one of very many supportive head teachers across the country. So thank you, Andy, for that. A question from PL, no name given. Around the summer, can they, I assume it's the senior leadership team there, force us to work extra weeks in the summer on catch-up or holiday clubs? Peter says, is there a plan to push for schools to remove GCSE results this year from appraisal? that link between some people's performance management and exam outcomes. That's never a wholly satisfactory link anyway. And Fatima asks, what about marking books? We've been told to do so, and clearly the concern there is not about marking books, but it's about the necessary safety precautions around transmission through touch. So if you could take that set, Mary, that would be fantastic. Thank you.
Okay, thank you. So very quickly, Robin, Andy, Ofsted aren't carrying out inspections now. We're having a meeting with Ofsted next week where they're going to talk to us about resuming inspections, and we're going to tell them very clearly that now is not the time to resume inspections. I mean, it would be very difficult to know what they would be inspecting against, because the new inspection framework is based on the national curriculum, which has been suspended until the end of the summer term, so that schools can focus on the key, the curriculum that they think is appropriate for children and young people who will have missed a lot of in-person schooling. So we don't think that Ofsted should be coming back in again. We don't think that that's appropriate. It can only increase pressure, and we don't think that's appropriate also for you know, the integrity of bubbles within schools. And we're going to be making that very, very clearly there to Ofsted. I'm glad you've got a supportive head. I would say if he's a supportive head, or she is a supportive head, they're probably doing the right things to improve the school and give them confidence that they're doing that and shouldn't be over concerned about Ofsted. PL, could they force us to work extra weeks? No, you can't be forced to work extra weeks. You have a contract. Your contract says 195 days, 1265 hours. What we do support, because we think summer holiday clubs will be really useful, but they should be on a voluntary basis. They are a very good place for newly qualified teachers who haven't managed to get work in schools or colleges to work, for supply teachers, and for those teachers or support staff who want to volunteer and be paid to work for the summer. That would be a choice which is open to them, but no one can be forced to work over the summer. And indeed, school staff, education staff, we know are on their knees and exhausted. So any notion of compulsion should clearly be out the window. As I said on Newsnight to Michael Wilshaw last week, when I was asked, should teachers be working weekends? And I said, teachers already work weekends. Teachers in England work twice the unpaid hours outside the classroom as any other OECD country. They work twice as long outside the class, 21.5 hours average teaching, and twice that preparing and assessing work. That's excessive. You can't just demand more and more work. So they can't force you to work extra weeks. This year's GCSE results cannot be included in your appraisal. They can't be. They're not going to be included for school league tables. So they cannot be used for your appraisal. And any suggestion that they should do so, then come back to the union, discuss that in your school groups, and make it clear to the management why they can't, to your leadership, why they can't be included. And marking books, it's the same advice as last time. If you're told to mark books, they should be quarantined. I've forgotten how long it was. Was it 2 days that they should be quarantined for before you touch them? And then so, you know, there's no sense that you can take books in and mark them and give them back the next day. There has to be a delay while those books are quarantined so that they are safe to mark, and then they can be returned.
Thank you very much, Mary. And I'll be coming back to you, Mary, in just a moment with a simple, single, final question, which will be, so what then, based on the advice tonight, should our members all across the country be doing as they return to their workplaces tomorrow? Just before we do, we've got a couple of questions on the other theme that was quite dominant tonight, and that's around phasing or rotated returns. And the questions are very simply phrased. I'm going to come to you, Kevin, on rotas and phasing. First, a question from Kirstin, who says, if a phased return is proposed for primary schools, what would that look like? Simple, straightforward question, and your thoughts, Kevin, would be helpful. And then a question from SR. What else can the NEU do to ensure that rotas happen? So this is just straightforward next steps advice on those two themes, please, Kevin.
Thank you, Robin. A phased return in a primary school could easily be infant classes back first, followed by junior classes sometime later, and we think that's happening in some places. on the question of rotas, I'd like to answer that in a slightly fuller way, if I could. I think the NEU and its members have done fantastic things during this pandemic. From the time we closed for schools to close to all except key worker and vulnerable in March, and we said to CEV and CV people that they should begin working from home, the 5 tests that we set, the education recovery plan, the checklist in September, the call that we made around Section 44 advice in January, which certainly made the government, I think, move faster on the obvious decision that it had to close schools at that point, apart from key worker and vulnerable. And our members have kept communities safer and kept the NHS going by educating key worker and vulnerable children during that period. We've kept staff safer. Now we're in this new position where the vaccine's being rolled out. That does start to change things. We hope that we are wrong about what's happening at the moment. We hope that cases don't rise when schools reopen. We think we will be, we think we won't be wrong. But what we will have during this period is 3 weeks of evidence of what happens when only schools, when schools are the only thing that's happened. And that will point at the truthfulness of schools contributing to the rise of the cases. So we will want to press to look at every bit of data, to press the case and to come back after Easter around that. Phasing now, but if cases go up, that shows that the mitigations that the government has in place are not working. And that will really make much more strong the case for rota operation, which SAGE said could reduce cases. So we will be looking at every bit of data that we can find. Cases have fallen dramatically since January. They're now falling. So it's unlike January when cases were really high and rising. Now they've fallen a bit and are still dropping. And that will give us a real chance to look at what happens when you open schools as a standalone. And that will give us a real place to make the argument about rota operations. If cases rise in this circumstance, then that makes the case for rotas so much stronger.
You're on mute.
Thank you very much, Mary. And not only that, but some of you may have even noticed I even completely disappeared from the call a few minutes ago, thanks to the wonders of technology, straight back in. And that actually gives me a chance to say thank you to John, Andy, Lawson, Dave, Mike and Amy, the people who've been doing the technical work behind the scenes. I'm still coming to you, Mary, with my question, but I thought I'd just take the opportunity to thank the technical team for being so superb in supporting us, and also Sam Riddle and Nikki Evans, who've been doing the BSL interpretation for us tonight. And so, Mary, we've got a final question for you, and I've already indicated what it is that I'm going to ask. And that's a straightforward question around what it is our members should now do collectively, with confidence, with assurance in their workplaces to ensure that together we're able to respond in the weeks and months ahead. Mary, if you would, please.
So thanks, Robin. I think the key thing for members to do is to meet with their school rep and to go through the new NEU, we're not calling it a checklist, but advice and guidance on the health and safety requirements in their school or their college, to go through those and to make sure that they're based on DfE guidance, but strengthened by the NEU, to go through those together, to make sure that their workplace is as safe and secure as possible upon their return. And to also raise any of the other issues which they are concerned about, which have been raised during this call. So if there are members who are CEV or members who are living with families who are CEV, to try to negotiate with the head that they either have the best ventilated classrooms, the places where you can socially distance the most, or that they can still continue to work from home, where there will still be work to be done. So do have a meeting, do look at our health and safety guidance, and do raise other issues in your union meeting, and then get those raised with your school leader. That's the key thing that all members should be doing during the rest of this week, prior to school commencing return on the 8th of March.
Thank you very much, Mary. And I know that everybody on the call will keep their eyes out on the NEU website for advice, guidance, checklists that you can use, and clarity on those questions as they unfold around looking after all our members in workplaces. We had several thousand people on the call tonight. Thank you for joining us. We had hundreds of questions and lots of comments in the chat. We'll be looking back through that and deriving from it answers and advice and guidance on the things we've not been able to answer tonight. We wish you all the very best for this evening, but also we wish you solidarity as you go forward together in your workplaces in the weeks ahead. Keep talking to each other, stay in contact with districts and branches, and please keep an eye out, as I say, for that advice and guidance. Thank you for joining us. Thank you, Kevin. Thank you, Mary, and it's a good evening.